Hi, my name is Bridget Kelly. I'm a physician assistant here at Aesthetic Enhancements with Dr. Armando Soto. Today I wanted to address the question that I get quite a bit, and that is, what age should I start doing Botox at? A lot of women come in their 30s and think, oh, I'm too young to start this, or they come in their 60s and think it's too late. So we just wanted to kind of address that question with people. And basically what I tell my patients is it's not necessarily about age. All of us have different skin texture, all of us have had different environmental factors on our skin, and we all make different expressions. So some people may frown more than others, and others may smile. So the area that you get Botox in or the age that you get Botox may differ a lot from person to person. So what I usually tell people is the time for Botox is when you're starting to see those lines without making faces. So basically, of course, every time that we frown or we lift our brows, we're going to see those lines. But when you start to see those lines on your skin, even when you're not making those faces, that may be the time to start to consider Botox. That's not to say that you have to go to Botox right away. You can try things such as Retin-A or maybe some chemical peels, taking care of the overall skin. But if you're not seeing a significant improvement in those lines or those wrinkles at that point, then it may be time to start to think about Botox. I think the other thing is that nowadays, Botox isn't just corrective, it's thought of as preventative, and a lot of people are getting more into that line of thinking that we should prevent the lines from forming rather than treat them once they're already kind of ingrained in the skin. So if you're doing it when those lines are just starting to appear, then you may be able to do Botox twice a year and have those lines prevented from ever really forming in the first place. On the flip side of that, it's never too late to do Botox. So if you're in your 50s or your 60s and those lines are pretty ingrained in there, it's still not too late. The Botox will still soften those lines significantly, and coupling that with things like maybe products or laser treatments can still make a significant impact on those lines, sometimes to the point where it never looks like they existed in the first place. So I think, again, the takeaway message is that it's never too late to start Botox, and the time to start considering it is when you're really bothered by those lines, whether that's at 30 or 40, whatever it is for you.